I was asked this week if I thought the consumer was a reason that a health system would select a specific technology. And I placed it at number 7 on my list of reasons they would select a technology. And I'm going to throw out my list, and I want to see if you agree with me. Here's my rank order of how things get prioritized in healthcare, at least technology decisions, right? So the first is to avoid a public failure or revenue disruption. And there's plenty of these stories around anytime you see a health system on the front page of a newspaper with a public failure or revenue disruption, an EHR that went, implementation that went bad, a breach. So that's priority number 1, avoid public failure or revenue disruption. Number 2, physicians are upset, right? Can't tell you the number of times I've heard, hey, this community of physicians is upset. We need to take care of that. New functionality that drives material revenue, right? If you can drive material revenue with the implementation of technology, that's going to be prioritized. Not number 1 or 2, number 3. Number 4, avoiding pain is more of a driver than actually, than actually getting more revenue. It's kind of interesting. Number 4, I said we can save money. Right? So if you have an ROI that's less than a year, that's going to be something that gets prioritized. The next is nurses and other clinicians are upset. Different category than physicians. Unfortunately, it's true. If there's a group of physicians that are upset, they are more tied to the revenue stream, so we take care of them. But not to be minimized, the nurses and the other clinicians are a group that you absolutely need to keep happy, and therefore that gets prioritized. What's next? We can be more secure or reliable. That's right, security is 1, 2, 3, 4, 5, is number 6 on the list. And number 7 on the list, I put patient experience. Okay, so that's my list. And that was off the cuff. I'm a little overworked right now, so I may be a little more cynical than usual. But I'm curious if you think the patient or consumer experience would rank above these 6 items. Okay, so the 6 items: avoid public failure, physician groups that are upset, new functionality that drives material revenue, saving money for the health system, nurses and a group of nurses or clinicians that are upset about something. We can be more secure or reliable. Do you think the patient experience ranks above any of those? And do you think there's others that might even rank above that when you're selecting technology? Let me know. Shoot me a note, Bill at thisweekinhealthit.com.